Good morning, everyone. Canada is being called to do its part to help stem the spread of mpox after the World Health Organization declared the virus a global public health emergency. Our Caryn Ceolin is joining us live now from outside of Toronto Public Health with everything that you need to know about this, including Toronto Public Health response to this as well. Caryn.
Well, Tammy, public health officials here in Toronto, they are urging eligible residents to get vaccinated against mpox, as cases here in the city have more than quadrupled so far this year compared to last. Now, the WHO's declaration of a global health emergency comes as a new form of the virus rapidly spreads in Africa, including in countries that have not previously reported mpox cases before. Now, this is the second time in 3 years that the WHO has declared mpox a health emergency. It did so last time in 2022. Now, the federal government says so far in Canada, there are no reported cases of this new strain of mpox, but the initial cases of the initial strain continue to crop up. And public health officials here in the city say the rise in cases here at home doesn't look to be travel related. However, they are still keeping an eye on it, giving the rapid spread in Africa and the possibility of it spreading beyond its borders. Public health officials here in the city, however, they do believe that this increase in cases was driven in June and July by major events and festivals that were happening here in Toronto. The city's associate medical officer of health now with who's most at risk.
The vaccine is being provided to people at high risk, so gay and bisexual men who have sex with men who have multiple partners, who have anonymous sex. People who are engaged in sex work are also eligible for the vaccine. So if you think you're at risk, really encourage you to speak to your sexual health care provider or book an appointment through one of the TPH clinics. Right now, people who got the vaccine in 2022 are still protected, so there's no need for a booster dose for them.
Now, TPH recommends 2 doses of the vaccine for the best protection. However, it says only a third of people who have received a first dose have actually received the second. And so if you have received 1 dose and didn't get your second shot, they are urging you to do so. You don't need a booster shot, as she said, and you don't need to get the first dose again, but you should get the second. Now, coming up at 9 o'clock this morning, infectious disease specialist Dr. Isaac Bogosh, he will be joining you, Tammy, live to talk more about what this global health emergency means for the local community here.
That's right. Thanks very much, Caryn. Caryn Ceolin live this morning at Yonge and Dundas.